Well, good afternoon. Over the past few months, every person in Ontario has been impacted by the pandemic in one way or another. We've all made great sacrifices, and the obstacles we have faced as a province are unprecedented. And I know that we all feel some uncertainty about the future. But no matter what obstacle, no matter what challenge, your government will stand with you. And as Premier, I will always have your back. We've all been put to the test. We've faced numerous challenges, and some communities are feeling the impacts more than others. But as I've always said, it's not the challenge that defines us, but it's how we face it. This is not only an opportunity to work through these difficult times, but it's also an opportunity to grow as a people and as a province. And we could not have come this far without working together, without supporting one another. And that starts with our young people. As we chart a path for recovery, we have to keep them in mind. Many young people are struggling and they're uncertain about what lies ahead. We have to give them hope. We have to set them up for success, and we have to give them a chance to lead. They deserve a shot at the same opportunities for a good education, for a good job, and for a good life, just as much as anyone else. And that's why I launched the Premier's Council of Equality of Opportunity a few weeks ago. We're going to keep tearing down the barriers, everything that stands in the way of our young people reaching their full potential. So today, our government is taking further action to support our young people. We're investing more than $13 million through the Youth Opportunities Fund to support 43 community-driven and youth-led projects that will create opportunities for our young people and their families. This funding will support local organizations doing amazing work in their communities all across the province. These grassroots organizations are making a real impact in their communities and supporting our next generation of leaders. We will continue to remove the barriers to success for our young people so each and every one of them can participate as full members of our economy and of our community. Because when we invest in our young people today, they can build a better tomorrow. Thank you, and God bless the people of Ontario. Now I'll hand it over to Minister Dunlop.
Good afternoon. I'm pleased to join Premier Ford today to announce the recipients of the 2020 Youth Opportunities Fund grants. I want to begin by offering my congratulations to all the organizations chosen this year. This fund is just one way our government is supporting local, community-driven, community-serving organizations and youth-led projects across Ontario. We are committed to helping young people and their families enhance their skills, connect with mentors, and develop stronger relationships in their communities. This year, 43 grantees have been selected to receive more than $13 million to support innovative projects in communities across our province. These projects will be led by youth and local leaders, and they will focus on issues they are passionate about. Some examples of these projects include Black Moms Connection, which will provide programs that build economic empowerment for Black mothers. Immigrants francophones d'Afrique pour l'intégration et le développement will provide support for newcomers from francophone African nations to navigate financial systems in Canada. Earthling Art Collective will help youth leaving care and the justice system to access mentorship opportunities and develop new skill sets. And Mizwe B Aboriginal Employment and Training will help Indigenous youth in the GTA access employment and training opportunities in the skilled trades. These projects and all this year's successful grantees understand the unique needs and identities of the children, youth, and families in their neighborhoods. They are in the best position to build local connections and develop solutions that fit the specific needs of the young people and families they serve. Stronger communities can't be delivered top-down from Queen's Park. They can only be built from the bottom up by the individuals and families who live there. Congratulations once again to the 43 successful community builders we are honoring today. I look forward to further working with these organizations to strengthen communities across Ontario. Thank you.
Okay, we'll go to the phone line for questions. First question.
First question comes from Christina Tenelia from CP24. Please go ahead.
Hi, Christina.
Hi there, Premier. Thank you so much for taking my call today. Can you hear me clearly?
Yeah, I can hear you loud and clear.
Okay. I just needed a minute to get my phones, and thank you for your time. My first question today, you've been clear that you don't support defunding the police, but
Yes.
It's almost inevitable now that this is what will happen here in Toronto after Mayor Tory's announcement today. Deputy Mayor Michael Thompson says that this is actually going to be a detasking of the police. So homelessness, domestic violence, addiction, social issues, assigning those responsibilities to other trained individuals. This also means, though, less money for the Toronto police, putting money towards those resources. I'm wondering why you don't support a detasking of the police, and should those who are specifically and specially trained to deal with homelessness, domestic violence, addiction, should they be tasked with responding to these calls or not?
Well, first of all, I just don't believe in defunding the police. I think it's a massive, massive error, and we can call it whatever it is. I believe in funding them, absolutely, when it comes to mental health issues, going on a call, which we are doing right now with certain areas. And we just gave the police additional money, no matter if it's about crime, guns and gangs, other areas. So when you call 911, we're short 100 police officers. You know, like you got to be kidding me. Let's increase funding for areas of community outreach. You know, building better relationships with communities. But just to cut them by what, $100 million, I'm hearing, and like. I don't understand it. I do not believe in cutting police budgets. Simple as that. I believe in increasing them and supporting them when it comes to, again, community outreach and other areas, be it mental health issues on a call. Yeah, are they not trained for that? I agree. There should be better training for the police in those situations and bringing someone, an expert, along with them. But just remember, if you call 911, you don't have someone showing up in an emergency. There's 100 police officers short right now, and I hear the stories from the frontline police officers. Downtown, there might be 3 or 4 cars sometimes in all of downtown. You know, do you want that? I don't want it. And I'll tell you one thing, I guarantee you the vast majority of the people, when you call 911, you expect the call to be answered, you expect the police to be there like ASAP, depending on what the 911 call is about.
Follow up.
Premier, I'm just wondering, because Mayor Tory, what he said today, and we've heard this from many people in the community, Mayor Tory said you cannot say that it is a system that is working when we have seen very recently instances of people in distress, police are called, and that person ends up dead. Now, we don't know all the details of some of these more recent cases yet, but I think everyone would agree that when you call police, and someone is in mental distress, medical distress, in a crisis situation, how are people ending up deceased?
Well, you know something, you make a very valid point, and that's where we need extra strengths with the police. We need more funding for issues if they go on a call, and if it's a mental health call and someone has an issue, just like you're seeing in Brampton right now. They have their team there. And yes, that's not a problem, but simply you tell the police you're cutting 10% and reallocating it somewhere else. Guess where they're getting it from? They're going to cut 100 police officers off the streets. I don't believe in cutting the police officers off the streets. I believe in increasing and supporting them on the different issues, no matter if it's community outreach or again, mental health issues. But you just don't cut frontline police officers, and that's what will end up happening. I'm not saying he's wrong. What I'm saying is you don't cut police. Ask for increased funding. Ask the feds. We gave a ton of money when it came to guns and gangs. I'll pitch in too. But let's get the feds involved, the province involved. But I do not want to see frontline police officers cut.
Next question.
Next question comes from Rob Ferguson from the Toronto Star. Please go ahead.
Hi, Premier.
Hi, Rob.
I just wanted to ask about this new report today from the Canadian Institutes of Health Information. It says Canada has been the worst in the OECD countries in terms of nursing home deaths, quite higher than average, and what you make of that.
Well, you know something, Robert, if someone really understands that and actually, you know, looks at percentages is one thing, but I just think it's a little unfair. They're comparing us to Spain, and I'll tell the people out there, so all of Canada is 6,900 deaths, and as far as I'm concerned, it's 6,900 too many in long-term care. We had another, I believe, 1,689, I'm not mistaken, in Ontario. That's 1,689 too many. But guess what? They're comparing 6,900 in Canada to Spain that has 18,000 deaths in long-term care. So the people that understand it, they look at it and they read it, and I just don't think it's fair, the percentages. But that's my opinion, and many others that read the same article.
Follow-up?
Okay, as a follow-up, you've promised to move the independent commission ahead to July.
Yes.
Into nursing homes. We are a week away from July. You haven't named a commissioner, terms of reference, a location, dates, anything like that. When is that coming?
Well, that should be coming very shortly, and you'll be the first to hear about it.
Next question.
Next question comes from Lucas Meyer from News Talk 1010. Please go ahead.
Thank you very much. Good afternoon, Premier.
Hi, Lucas.
Premier, as you saw as I'm sure you read on Mayor Tory's motion on the changes, there were actually calls for the province to do some things too.
Yep.
One of those is to review the Police Act and review and overhaul equipment and use of force regulations to emphasize de-escalation, you know, and further methods, you know, to address deadly force. So, you know, the province taking a more active role in looking at its own legislation. Will you commit to that? Sure,
I'd be more than happy to sit down and talk to the mayor and talk to other mayors within Ontario and get their input. But I also want to sit down and talk to the police as well. So that's what I think we need to do. And you know something, again, I'm not saying, you know, it's right or wrong. I just don't believe in cutting frontline police officers. What I do believe in is supporting them through the province or the feds to address these issues. And absolutely, I'd be more than happy to sit down and talk to anyone about this.
And Premier, just kind of on a broader scale about this whole question, I mean, one of the suggestions by Councillor Carroll was allowing the city's Auditor General to be involved in provincial discussions around police budgets, because obviously the Police Act holds a lot of power. So just in a general sense, as Premier, are you willing to really look at giving municipal governments more control around police budgeting in a more general sense?
Well, I'd be more than happy to sit down and talk to the municipalities, especially the large municipalities that are facing some issues. I'm always open for a good conversation, and have our Solicitor General there as well. And I'm always open to conversations. I never close the door on any idea, by the way.
Next question.
Next question comes from Mike Crowley from CBC. Please go ahead.
Hi, Mike.
Hi, Premier Ford. Today, we're seeing some calls from the tourism industry across Canada to open the border a little more, allow international travelers in, perhaps from some selected countries, and dispense with the 14-day quarantine in some circumstances. I realize, of course, you know, this is a federal issue, but you might have some thoughts on that. How do you feel about the idea of opening the border to some extent to allow international travelers to come in and help the tourism industry?
Well, I talked to an expert in this, and his conversation kind of went like this. You're doing so well in Ontario and Canada, and looking at the numbers come down. And I said, well, what do you think about the second wave? He says, do you know when the second wave is going to happen? He says, when you fully open up and you let people from around the world come back into Canada. I know it's inevitable. We got to do it. I just don't think we're ready right now. You see what's happening down in the States. You look at Florida, you look at Texas, Arizona, California. I don't want to be those states. I want to protect the people here in Ontario, and I just think we're opening it up too early if the decision's made on July the 21st. I just don't think we're ready for people south of the border. And believe me, I love the Americans, make no mistake about it. but not when their COVID cases are just spiking right now, and I'm just not in favor. I got to protect the people of Ontario. Business is still going back and forth. The goods are going back and forth, so that's the most important.
Follow up.
On another topic, Premier, Quebec has announced that because their COVID-19 numbers are declining, that they're not going to actually release the data. The Ministry of Health in Quebec is not going to release the data on a daily basis. They're now only going to release it weekly. What's your commitment for Ontario's release of COVID-19 data while the pandemic is continuing?
I'll pass this to the Minister of Health.
It's really important in Ontario, as the Premier has always said, that when he knows something, the people of Ontario will know something. And so we're going to continue to report that information daily. That is important to a lot of people. They want to know how many new cases we have. They want to make sure that the numbers are going down, which happily they are, and they want to know how many tests we're doing as well. Yesterday it was 27,000 tests with under 100 new cases. So we're making progress, but that's something that we believe the people of Ontario are entitled to know on a daily basis.
Next question.
Next question comes from Colin DeMello from CTV. Please go ahead.
Hi, Colin.
Hi, good afternoon, Premier. I just had a question about long-term care. So the Ontario Long-Term Care Association has said that your government is not really preparing Ontario's long-term care homes for a second wave of the virus. They say that beyond the action plan that was announced back in April, nothing really has been done since then. So can you tell us, how is your government specifically preparing long-term care in this province for the second wave?
Well, Colin, I'm going to address a story that was floating out there. First of all, that's what I want to do. There was a story, and it didn't come from you, but we all have a responsibility to do our due diligence, and I guess the Post media, they ended up scrapping it, but it kind of got out there anyways, and it was riddled full of errors, and it's simply not true about us saying we aren't going to fund hiring staff at long-term care, and the facts speak for themselves, and this rolls into what are we doing to prepare for a second wave. We've increased funding for long-term care, $243 million of new funding, and we immediately injected it into the sector to help deal with the COVID. And we made it flexible. Those are the magical words. And there was $25 million for emergency funding, another $88 million for prevention and containment of the virus, another $130 million to create additional capacity in homes. We also increased the level of care funding by 1.5% and provided over $8 million to help support the staff wage subsidy and the pandemic pay. And, I've stood here time and time again and said we're going to fix a broken system that we inherited. And after the Wettlaufer inquiry, we launched a working group on long-term care staffing strategy, and we'll recommend some real long-term care sustainable options, and we're waiting for them to come back to us. But on the funding mechanism, when we gave $243 million on that, the minister actually wrote them a letter saying this is flexible funding, and by the way, you can either hire more staff or you can increase the pay to the people. And we actually have letters back from long-term care homes saying thank you very much. And not all the cases, some decided to bump up wages, but the majority of them said we're hiring more staff. So again, the working group that we put together was launched in February, and we're expecting a report back very soon. And these changes will be part of a broader reform, but I'll tell you, as soon as we get that, I want to give long-term care more money. So I just want to put a clarity on that conversation. So that's some of the things that we're doing to help long-term care.
Follow up.
All right, thank you, Premier. And on another topic, my family went to a park yesterday, and we noticed people on the tennis court, a public pool being prepared to open, kids training for the baseball season. But the only place that was empty was the jungle gym. I think a lot of families are wondering when can their kids go back to the playgrounds and actually start enjoying those that equipment. When can those kids get onto a playground again?
Well, I think when we hit stage 3, phase 3 per se, I'm sure after a consultation with our Chief Medical Officer of Health and our Minister of Health and our health team, they'll decide that factor. Right now, I guess they're keeping them closed. But again, even when we make that decision, Colin, it's going to be up to the regions, be it the city or any region. People, don't underestimate the power of local chief medical officers of health under Section 22. So we could say open up the playgrounds and they could shut them down in a certain region. And I think that's a good thing that they're able to do that, because every region's different.
Next question.
Next question comes from Randy Raft from Sage TV. Please go ahead.
Hey, Randy.
Hi, Premier. We're seeing evidence of an increasing number of people buying into conspiracy theories about COVID. A Niagara councillor from Port Colborne says that she's seeing employers in her area calling it a planned demic and not taking it seriously and discouraging their employees from wearing PPE. Are you worried about that sort of thing spreading in the province?
Well, I think that'd be irresponsible of any employer. Every employer should have hand sanitizer, have the option of wearing a mask. They should encourage social distancing within the workplace. This isn't over. I can't stress it enough. We're doing great because everyone listened. All 14.5 million people have been fantastic. Everyone's been great. The media's been great. The companies have been great. Have a champion minister of health, great doctors, great health teams. But man, this thing comes back. That's what concerns me. So we have to stay focused, and we can't let our guard down for a heartbeat. We let our guard down, and look what happened to Florida. Look what happened to California and Arizona and Texas. That's what happens when you're reckless, you're careless, and you let your guard down. So when possible, wear a face covering.
Follow up?
Okay, and if we do see a resurgence, numbers spiking up again, is there a plan to shut it back down? Do you have protocols in place and a plan to go back to stage 1 if that's necessary in some regions?
Well, we're going to have to look at the numbers if that day comes, and let's just pray it doesn't come. But I can tell the people of Ontario, all of us, and I'm including, when I always say the people, it's all of us combined. When I talk about this, are we better off and better prepared than we were? I think 100 days was yesterday, over 100 days ago. We're so much better prepared. We're better prepared on the procurement system with the PPEs. The hospitals are better prepared. Everyone's better prepared because we've lived the experience. And anytime we've seen a hurdle, everyone joins together as a province or sectors or stakeholders, and we get through it. And I couldn't do it without people out there. I'll tell you, without the help of everyone in the province. And that's the only reason we're able to be doing as good as we're doing.
Last question.
Last question comes from Cynthia Mulligan from City News. Please go ahead.
Hi, Premier.
Hi, Cynthia.
Back to the report that Rob Ferguson from the Star mentioned that was critical of deaths in Canadian long-term care.
Yeah.
Prime Minister Justin Trudeau was asked about that very report this morning, and his response was, and I quote, "It's provincial jurisdiction. It's them who have failed our seniors." What do you say in response to that? Because it seems he's blaming the provinces.
Put your money where your mouth is. Help us out. We can't do it alone. Support us. He's been very supportive, by the way, but I'm a little shocked with his comment, to be very frank with you. We're supposed to be all in this together. Let's all be in this together. When we talk about the health transfer funds that we're getting, is supposed to be a real partnership. Some provinces are getting as low as 18%. We're getting about 22%. That's not a partnership. We're putting the whole burden of the healthcare system, which is massive in Ontario, on our shoulders. And we need support. We need a partnership, a real partnership, because we're working as hard as we can. So I don't know if he spoke out of line, because he's been pretty good. I'm not knocking the guy. He's just I don't know, I might say a few things that are off kilter too some days. So, but we need his help, and so far they've been pretty good, the feds.
Follow-up.
Thank you. And to pursue a question from Colin DeMello, you know, if there is a second wave potentially in the fall, what more measures need to be in place to protect long-term care? Because we know that they've been frayed to the edges and they've been pushed to the brink. I know you've said that you've put in millions more, but how will they cope when they're already so decimated? How will they cope with the second wave, and what can be done to help them further?
Well, we won't spare a penny. I know I mentioned the $243 million and kind of broke it down, but we won't spare a penny. We're waiting for the working group to come back, because I want to put more money in there, and we have to make sure that we separate the congregate living and maximize it to two, because you know, once it gets into these homes, I'll tell you through what I've seen, it's tough to get your hands around it. But there's 4 to a room in some cases, so maximum there should be ever is 2 to a room. But if you don't mind, I'm going to hand it over to the Minister of Health.
Well, I think there's several things that we need to deal with. As the Premier said, that there are some of the homes are 4 bedrooms that are now 2 bedrooms, that we need to make sure that people are protected. We need to make sure that we continue to follow the safety precautions for visitors and for staff. We need to keep doing the testing on a regular basis. Even though people have already been tested once and staff have been tested once, we need to continue to be in there and to deal with that. But the other thing that we're dealing with is the a potential second wave, but also the upcoming flu season. So we have ordered extra vaccines of the higher level dosage for seniors. We intend to offer that vaccine to all of the seniors in our long-term care homes, to staff as well, to people who live in congregate settings like retirement homes, group homes, and so on. So we need to make sure that we can continue to protect them from the flu. And then, of course, we are enhancing our testing capability, because it will be necessary to do more testing to determine if people fall ill, whether they have the flu, which can be dangerous in and of itself, or whether they have COVID-19. So we need to do that, and the contact management as well. So we are taking precautions for long-term care homes with the upcoming flu season and potential second wave, as well as for all the other seniors in Ontario and the rest of the population as well.
Okay.
Thank you.
Thank you, everyone.